Despite having a population of 220 million plus people, Pakistan only offers healthcare to 50% owing to the lack of physicians. Of the 2,45,000 licensed physicians in Pakistan, 80% are female. However, due to social and cultural reservations, only 40% of them practice medicine, and another 15% of physicians leave Pakistan for better work opportunities. Sehat Kahani, founded by the two female doctors, Dr. Sara Saeed Khurram and Dr. Ifat Zafar Aga, is Pakistan's leading digital healthcare company that has given access to quality and affordable healthcare service through user-focused ICT solutions implemented by a network of qualified female HCPs and specialists and through a network of nurse-assisted e-health clinics in low-income communities. To date, through an extensive network of 7,500 plus female HCPs trained to continue their medical practice through telemedicine. We have enabled 48 nurse-partnered e-clinics to provide quality healthcare to people who had never seen a qualified doctor before. Our mobile app has a consumer interface with 1.15 million downloads and a corporate interface where we have a network of 600 plus corporations using our services. We have successfully conducted over 1.9 million active online consultations. Apart from the e-health clinics which are already present in low-income settings, with many within humanitarian communities, a large number of our consultations come from Tier 3 and Tier 4 cities. We realize that scale can only happen with the support and partnership of the government. In order to cater to this, Sehat Kahani for the very first time created a public-private partnership with the IT Board of Azad Jammu and Kashmir, with which we established telemedicine platforms within 13 basic healthcare units. These telemedicine centers were equipped with the state-of-the-art technology, telemedicine software, and digital tools to make accurate diagnosis. To tackle the attrition of doctors and to enable healthcare to all at these clinics, Sehat Kahani encompassed the following components: integration of e-tools such as e-stethoscopes, ultrasound probes, e-glucometer, and e-blood pressure devices into these e-clinics enabled efficient diagnostics and seamless transition of data within our telemedicine setup. In these 13 BHUs, we have seen 4,307 plus patients so far, with a major focus on maternal and child health. Many of these patients had never seen a qualified physician in their life, owing to the remoteness of these clinics.
I'm Dr. Khalid Rafiq. I'm Director General, AJK Information Technology Board. AJK Information Technology Board is responsible for introducing ICT-enabled interventions for public sector organizations and steering ahead all IT initiatives in AJK. That includes even improving the ICT infrastructure and especially digital governance in AJK. So with the improvement of this ICT infrastructure, it was in our mind that we should connect remote BHUs, small clinics in the government sector with the major hospitals or some third party. So this is actually it is going to help the public at large, because they need to travel a lot to going to the larger hospitals. So that was the reason behind this, in fact. So we wanted to go with a partnership with some third party. We wanted to improve the ICT infrastructure of public sector health units also. So while we were trying to reach out to different operators or different service providers who can come and assist us in this, we approached Sehat Kahani, and then seeing their profile, interaction with them, we felt very comfortable. And then over and above all this, there was a process, it's a government process of tendering all this. They came through this, and then they won this tender, as well as a small tender to introduce these services. And since then on, we felt very comfortable, in fact, with them, because they have worked a lot in this area, and actually they are guiding this digital transformation in AJK. It is quite a beginning now, but we are seeing very encouraging results, especially the areas which are very far flung. I have personally visited all of these telemedicine centers and have seen great encouragement from the people living around. So for them it is very good, in fact, because they needed to travel to go Islamabad and Rawalpindi, which apart from this consultation fees and all this, there was a lot of hassle of logistic and all this. So at least that thing is addressed now, and slowly it is picking up, in fact. And hopefully, because I personally see that this is going to be a future of health industry. I feel that it is a major disruption in the health industry, and it's going to change it by large, in fact.
Despite these opportunities, healthcare, especially for this large population, needs a lot of support. Often the diagnosis is based on the doctor's own knowledge and lacks uniformity, which often leads to missed diagnosis. The World Health Organization reported that approximately 5% per year of adults encounter diagnostic errors in high-income countries, with nearly 850,000 diagnostic errors reported annually from developed countries. Managing such clinical diagnosis uncertainly causes a problem, especially for inexperienced physicians. Our basic objective is to automate the process of diagnosis by digitalized means. Another challenge Pakistan faces is the lack of interactivity. When a patient accesses a telemedicine platform such as Sehat Kahani, who may need tertiary care referral, the technological systems often don't communicate with each other. This results in gaps in the patient's treatment. Seeing these challenges, we worked extensively on how we at Sehat Kahani can resolve some of these system-based challenges. We created an extensive decision-making tool that would be integrated into our telemedicine system using automated decision support algorithms. This will allow physicians and intermediaries to follow patient treatment decision algorithm. This tool would make real-time decision-making more uniform and streamlined for both patients as well as physicians. As we implemented this solution in some of our very remote clinics in Azad, Jammu and Kashmir, we realized the ease as well as the uniformity of this solution within these clinics for both patients as well as physicians.
अस्सलाम वालेकुम, मेरा नाम आयशा है। मैं 1 माह से मुझे तेज़ बुखार हो रहा था, साथ में मुझे वॉमिटिंग भी आ रही थी, भूख बिल्कुल भी नहीं लग रही थी। तो मेरे हस्बैंड मुझे हॉस्पिटल लेके गए। वहाँ पे उन्होंने हमें टेस्ट का बोला, हमने टेस्ट करवाए, लेकिन कोई भी बीमारी जो हमारी सामने नहीं आ रही थी। इतने में हमारे रिश्तेदारों ने हमें सेहत कहानी के क्लिनिक के बारे में बताया। मैं और मेरे हस्बैंड वहाँ गए। वहाँ पे नर्स ने हमारा फॉर्म भरा, फिर ऑनलाइन डॉक्टर साहिबा से उन्होंने हमारी बात करवाई और डॉक्टर साहिबा ने मेरी बीमारी जो है बताई। मैंने अपनी उन्हें कंडीशन बताई। उन्होंने मुझे फिर बताया कि आपको टाइफाइड है। फिर उन्होंने मुझे दवाई दी और साथ में कहा कि अपना ख्याल किस तरह से रखना है। फिर मैंने डॉक्टर साहिबा की बातों पे अमल किया और आज अल्हम्दुलिल्लाह से मैं बिल्कुल ठीक ठाक हूँ और मैं सेहत कहानी की बहुत शुक्रगुजार हूँ।
I'm Dr. Sadia Khalid and I've been working with AJK Clinic. Sehat Kahani has given us the opportunity to work in AJK clinics and to help all the people who are living in AJK and they have limited access to the healthcare facilities. Our healthcare system actually provides not only the remote patient monitoring but as well as the diagnostic tools plus medicine management. So the patient decision-making tool, this is very important, especially for the doctors who are coming to this profession after a long break. And this system change is easily adapted by all the people, not only the doctors, but as well as healthcare workers.
We have also been working towards integrating an e-referral mechanism for accessibility to standardized healthcare services. An e-referral mechanism requires extensive collaboration with tertiary care hospitals in Pakistan. Oftentimes, these are heavily paper-based and do not operate on EMRS and digital software. An e-referral also requires an opportunity for the hospital HMIS to integrate and communicate with other systems. Our teams have also visited many tertiary care hospitals within Sindh, KP, and AJK to explore this opportunity. When we say democratize healthcare for all, we mean all. and we stand by it. With continued innovation, Sehat Kahani works to make healthcare accessible, simple, and affordable to everyone, from Karachi to Kashmir, regardless of anyone's gender, race, and socioeconomic condition or literacy.